Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1. Questions 1 to 12. You hear a neurologist talking to a patient called Mr. Allen. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good afternoon, Mr. Allen. I see you've been referred to me by your GP. How are you feeling today?
Good afternoon, Doctor. Well, to be honest, I'm feeling a bit anxious. The GP mentioned something about a possible meningioma, and I've been trying not to panic.
That's completely understandable. Let me reassure you right away that meningiomas are often benign, meaning they're not cancerous. But before we get ahead of ourselves, let's go over your symptoms and history in detail. Could you start by telling me what's been bothering you?
Sure. It started a few months ago, really. I began getting these headaches that seemed different from what I'd had before. They're not sharp pains exactly, more like a constant pressure, especially in the mornings.
I see. And have you noticed any other symptoms? For example, changes in vision, balance, or memory?
Yes, actually. My vision's been a bit blurry now and then, and sometimes I see double, especially if I'm reading or using my computer for too long. My wife also noticed that I've been a bit unsteady on my feet. A few weeks ago, I stumbled while walking down the stairs, which really scared me.
That does sound concerning. What about your memory or concentration? Any changes there?
It's funny you should ask. I've been forgetting small things, like where I've left my keys or what I walked into a room for. And, at work, I sometimes lose my train of thought mid-conversation, which is embarrassing.
I can understand how frustrating that must be. Have you experienced any numbness or weakness, perhaps in your arms or legs?
Actually, yes. My right hand feels weaker than it used to, and sometimes I get this tingling sensation that comes and goes.
Thank you for sharing all of that. It gives me a clearer picture of what might be going on. Now, just to confirm, do you have any history of head injuries or family history of brain tumours?
Not that I know of. I've never had a head injury, and as far as I know, no one in my family has had anything like this.
All right. That's helpful to know. Let's talk about the next steps. Based on your symptoms and the initial findings from your GPA meningioma is a possibility. These are tumours that arise from the meninges, the protective layers covering the brain and spinal cord. While the word tumour sounds alarming, I want to emphasize that most meningiomas grow very slowly and are benign.
That's a bit of a relief. But how do we know for sure?
To confirm the diagnosis, I'll recommend an MRI scan. This will give us a detailed image of your brain and help us see if there's a tumour, where it's located, and how large it might be. Depending on what we find, additional tests, like a CT scan or biopsy, might be necessary, but the MRI is the first step.
Okay. What happens if it turns out to be a meningioma?
Treatment depends on a few factors, such as the size and location of the tumour, how quickly it's growing, and whether it's causing significant symptoms. If it's small and not pressing on vital areas, we might just monitor it with regular scans. On the other hand, If it's causing symptoms like yours, surgery to remove it is often the best option.
Surgery? That sounds serious.
I understand it might sound daunting, but the good news is that meningiomas are often well-defined and easier to remove than other types of brain tumors. Neurosurgeons are highly skilled at this, and the success rate is very high. For some cases, if surgery isn't suitable, we can also use radiation therapy to shrink the tumor.
I see. And what about the risks?
That's a good question. As with any procedure, there are risks, such as infection or bleeding, but these are relatively rare. The specific risks depend on the tumor's location. For example, if it's near areas that control speech or movement, we take extra precautions to minimize any impact.
That's reassuring. Is there anything I should be doing in the meantime?
For now, focus on managing your symptoms. If the headaches are persistent, over-the-counter pain relief might help, but avoid anything stronger unless prescribed. Stay hydrated and try to reduce stress. It can exacerbate symptoms like headaches. And if you notice any sudden changes, such as worsening vision or severe weakness, contact us immediately.
All right. Is this related to anything I've done? I mean, could I have prevented this?
No, there's no specific cause for meningiomas that we know of, although they are slightly more common in women and tend to appear later in life. Factors like previous radiation exposure or hormonal changes may play a role, but they're not things you could control.
I see. Well, thank you for explaining everything, Doctor. It's a lot to take in, but I feel a bit calmer now.
I'm glad to hear that. Remember, you're not alone in this. We'll take things one step at a time. Once we have the MRI results, we can discuss the best course of action together.
Thank you. I appreciate that.
You're welcome. Take care, Mr. Allen, and we'll be in touch soon.
Extract 2, questions 13 to 24. You hear a gastroenterologist talking to a patient called Mr. Logan. For questions, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning. Mr. Logan, I believe.
Yes, that's me, Trevor Logan.
Nice to meet you, Mr. Logan. I understand you've been experiencing some issues related to abdominal pain?
That's right. It started a few months ago and it's been getting worse.
Alright, I've read through some of your notes, but it's always helpful to hear directly from you. Can you tell me more about the pain? Where exactly is it located, and how would you describe it?
It's right here, just above my stomach, in the upper part of my abdomen. It's a deep, burning pain, and sometimes it radiates to my back.
I see. When does the pain usually occur? Is it related to meals or any specific activities?
It often starts after I eat, especially if the meal is heavy or greasy. Sometimes it's so bad that I can't finish eating, and it lasts for hours.
Have you noticed any other symptoms alongside the pain, such as nausea, vomiting, or changes in your bowel movements?
Yes, actually. I've been feeling nauseous quite often, and I've thrown up a few times after eating. Also, I've had some diarrhea that looks greasy. Sorry if that's too much information.
Not at all. That's very relevant information. Have you experienced any significant weight loss or appetite changes?
Yes, I've lost about 10 kilos over the past 2 months, and my appetite just isn't what it used to be.
Thank you for sharing all this, Mr. Logan. It sounds like you're dealing with some classic symptoms of pancreatitis. Have you had any previous episodes of this kind of pain or been diagnosed with gallstones or other issues related to your pancreas?
Not exactly, but I was in the hospital last year with gallstones. They told me it wasn't urgent at the time, so I didn't have surgery.
That's helpful to know. Gallstones can sometimes block the bile duct and trigger inflammation in the pancreas. Additionally, alcohol consumption is another common factor. Do you drink alcohol regularly?
I do, but only socially, maybe a few beers on weekends.
Understood. While moderate drinking is less likely to cause pancreatitis, it's something we'll evaluate further. Have you noticed if the pain or symptoms worsen after drinking?
Now that you mention it, I think they might.
Alright. Based on what you've described, it's likely that your pancreas is inflamed. The symptoms, including upper abdominal pain radiating to your back, nausea, vomiting, greasy stools, and weight loss, are all consistent with pancreatitis. We'll need to confirm this through tests.
What kind of tests?
We'll start with blood tests to check your levels of amylase and lipase, enzymes that are typically elevated in pancreatitis. We may also order imaging studies, such as an abdominal ultrasound or a CT scan, to look for inflammation, gallstones, or other potential causes.
Will I need treatment right away?
If pancreatitis is confirmed, the treatment will depend on the severity. For mild cases, we focus on resting the pancreas by keeping you on a clear liquid diet or fasting for a short period. You'll also receive IV fluids to prevent dehydration and manage pain.
And if it's not mild?
For more severe cases, hospitalization may be required. We'd monitor you closely, address complications, and possibly perform procedures to remove gallstones or relieve duct obstructions. If alcohol is a contributing factor, we'd recommend abstaining completely.
That sounds serious. Is this something I'll have to deal with long term?
That depends on the cause and how well we can address it. Acute pancreatitis often resolves with proper treatment, but if left untreated or if there are repeated episodes, it could lead to chronic pancreatitis, which can cause permanent damage.
I see. Is there anything I can do now to help?
Avoiding alcohol entirely and sticking to a low-fat diet can help reduce strain on your pancreas. We'll also need to address the gallstones if they're contributing. Once we have your test results, we can discuss a more tailored treatment plan.
Alright, that makes sense.
Great. Let's start with the tests and go from there. We'll ensure you get the care you need to manage this effectively.
Thank you, Doctor.
You're welcome. We'll work together to get this under control.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a brief doctor's consultation. Now read the question.
Hello, what brings you in today?
I've been feeling unwell, and the antibiotics I was prescribed last week don't seem to be working.
I see. Did you complete the full course of the antibiotics?
Yes, I did, but the symptoms haven't improved at all.
That's concerning. Sometimes bacteria can become resistant to certain antibiotics. Did you have this kind of infection before?
Yes, a similar one about 6 months ago. I was prescribed antibiotics then as well.
That might explain it. Repeated antibiotic use can sometimes contribute to resistance. We'll need to run some tests to determine the best course of action.
I hope it's nothing serious. I've been really careful about taking the medicine as directed.
That's good to hear. Don't worry, we'll figure out a treatment plan that works for you.
Now look at question 26. You hear a senior doctor providing feedback to a trainee after a simulation exercise. Now read the question.
Your approach to managing a critical situation?
I suppose it means I need to trust my decision-making process more.
Exactly. Especially in simulations like these, we need to act decisively while still considering all the clinical data. That hesitation could have cost valuable time in a real-life scenario.
So, should I prioritize administering treatment faster next time, or should I wait to double-check?
It's about finding the balance. But in this case,
Acting sooner would have been ideal.
Now look at question 27. You'll hear a physician in the A&E department talking with a patient presenting with abdominal pain. Now read the question.
So, Mr. Benson, you're experiencing pain in your abdomen?
Yes, it's been bothering me for a couple of days. It started off as mild discomfort, but now it's sharp and localized.
Sharp pain that worsened over time. Do you also feel any nausea or changes in your bowel habits?
Yes, I've been feeling a bit nauseous, and I noticed that my bowel movements have been irregular.
I see. Based on your symptoms and the location of the pain in the lower right quadrant, I'm concerned about appendicitis. To confirm, I'll order an ultrasound. In the meantime, I'll start you on intravenous fluids to keep you hydrated.
Okay, thank you.
Now look at question 28. You hear a nurse talking to another nurse about a patient receiving care for severe depression. Now, read the question. John, do you have a minute? I need to talk to you about something.
Sure, what's going on?
I noticed you seemed a bit dismissive toward Mrs. Carter, the patient with severe depression. She's clearly struggling, and it's important that we approach her with empathy and understanding. However, I feel like you're not engaging with her enough to make her feel supported.
I know, but sometimes I just feel like patients like her exaggerate their issues. I mean, if she really wanted to get better, she could pull herself out of it instead of just dwelling on her problems.
John, remember, mental health is as serious as physical health, and people with depression can't just snap out of it. Our role is to provide non-judgmental care and support their recovery, not to question or downplay their experience. Imagine if you were in her position, or if a loved one was struggling with depression, would you want them to feel misunderstood? Now look at question 29. You hear a training session on how supplements can enhance an athlete's performance. Now read the question.
In today's training, we'll explore how supplements can enhance an athlete's performance when used correctly. Supplements like protein powder, creatine, and vitamins can play a pivotal role in supporting athletes' training and recovery. However, it is crucial to understand when and how to use them effectively to avoid over-reliance or potential side effects. Dietitians can assist general practitioners and athletes by conducting a thorough dietary review to determine if supplementation is necessary and appropriate. For instance, let's look at the case of Sarah, a sprinter preparing for a major competition. Sarah wanted to optimize her recovery and muscle strength. So we evaluated her diet to assess if her protein intake met her rigorous training needs. We calculated that she needed an additional 20 grams of protein daily to support muscle repair and recommended incorporating a high-quality protein powder post-workout. Regarding creatine, her natural dietary intake was sufficient, so additional supplementation wasn't necessary. For vitamins, we identified a mild deficiency in vitamin C and advised her to include a supplement for short-term improvement while also increasing her intake of vitamin C-rich foods.
Now look at question 30. You hear a medical professional talking about a memo. Now read the question.
About the introduction of cross-department collaboration programs, and I'm sure you've thought about how this might affect your day-to-day responsibilities. You're probably aware of the potential benefits, such as improved patient outcomes through better communication and resource sharing. That's not up for debate, but I understand there are concerns about how this might impact your existing workflows. I've heard comments about how stretched everyone already feels, with worries about additional meetings or tasks slowing down your routine. Let me assure you, we've developed these programs with your workload in mind. Processes have been streamlined to prevent overlap, and participation will focus only on essential cases where collaboration truly adds value. Furthermore, clear guidelines have been established, detailing which scenarios require input from other departments and how communication should occur. Supervisors will also monitor the implementation to ensure that your core responsibilities remain unaffected.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear a detailed overview of a new research study. You now have 90 seconds to read questions.
Hello everyone, thank you for being here today. I'm excited to present an overview of a new research study being conducted by the Healthy Futures Research Initiative. This study focuses on early intervention strategies for preventing childhood obesity, a condition that has become a significant public health challenge worldwide. To start, let's look at the current state of childhood obesity. Globally, it is estimated that nearly 20% of children aged 5 to 10 years are classified as obese. This figure has tripled over the past 3 decades. Obesity is particularly concerning in young children because it is often associated with long-term health risks, including diabetes, heart disease, and joint problems. Additionally, children with obesity frequently experience social and emotional challenges such as bullying and low self-esteem. The study we're conducting aims to address these challenges through early intervention. Specifically, it will test the effectiveness of a combined approach involving diet modification, regular physical activity, and behavioral counseling for children aged 3 to 7 years. Research has shown that early childhood is a critical period for establishing lifelong habits, making this age group ideal for targeted interventions. First, let's discuss the dietary component. The goal is to encourage families to adopt a balanced and nutrient-dense diet for their children, emphasizing whole foods such as fruits, vegetables, lean proteins, and whole grains while reducing sugar and processed foods. Families in the study will work with registered dietitians to create personalized meal plans that meet their child's nutritional needs and fit within their lifestyle. The aim is not just to reduce calorie intake, but to foster a positive relationship with food. Next, we have the exercise program. Many children today are less active than previous generations due to factors such as increased screen time and reduced outdoor play. In this study, children will participate in structured physical activity sessions twice a week, led by certified trainers. These sessions will focus on age-appropriate exercises that are both enjoyable and effective in promoting cardiovascular health and muscle development. Additionally, families will receive guidance on incorporating more physical activity into their daily routines, such as walking to school or playing active games. The third component is behavioral intervention, which is essential for addressing habits and attitudes that contribute to obesity. Families will attend weekly counseling sessions led by trained psychologists. These sessions will focus on topics such as recognizing hunger and fullness cues, managing emotional eating, and building self-confidence in making healthy choices. The aim is to equip families with the tools to sustain these lifestyle changes long-term. The study will divide participants into two groups, an intervention group and a control group. The intervention group will follow the diet, exercise, and behavioral counseling program, while the control group will receive standard advice on healthy living without additional support. Both groups will be monitored for changes in weight, body mass index, BMI, physical fitness, and psychological well-being over the course of 1 year. One of the unique aspects of this study is its focus on family involvement. Obesity prevention requires a supportive home environment, and involving parents or caregivers in the process is key to success. Families will be encouraged to participate in all aspects of the program, from meal preparation to exercise sessions, creating an atmosphere of shared responsibility and mutual encouragement. Current treatments for childhood obesity often focus on weight loss after the condition has already developed. However, this study aims to shift the focus to prevention, which is often more effective and less costly in the long run. Early intervention has the potential to significantly reduce the risk of obesity-related health problems and improve the quality of life for children and their families. This research builds on previous studies that have shown the importance of early lifestyle interventions. For example, a 2019 study found that children who participated in a similar program had a 30% lower risk of developing obesity by the age of 12, compared to those who did not. By addressing the root causes of obesity during early childhood, we hope to achieve similarly promising results. We're optimistic that this study will provide valuable insights into the best practices for preventing childhood obesity. However, it's important to note that the results won't be available immediately. Data collection and analysis will take time, but we're committed to sharing our findings with the medical and public health communities once the study concludes. Thank you for your attention, and I'd be happy to take any questions at the end of this session.
Extract 2. Questions 37 to 42. You hear an interview with Dr. Amanda Collins discussing a recent study. Now, read the questions. You now have 90 seconds to read questions.
Welcome, everyone, to today's discussion on groundbreaking advancements in vaccine technology. We're excited to have Dr. Amanda Collins, an expert in immunology and vaccine development, joining us. Please give her a warm welcome.
Thank you for the kind introduction. I'm thrilled to be here to share insights into this exciting field.
Dr. Collins, your team recently published a study in the Lancet Infectious Diseases about mRNA vaccine technology. What inspired you to focus on this particular area of research?
Well, traditional vaccines typically rely on inactivated pathogens or protein subunits to elicit an immune response, which can take years to develop. During the COVID-19 pandemic, the urgent need for rapid vaccine development prompted researchers to explore mRNA technology. Unlike traditional approaches, mRNA vaccines deliver genetic instructions to cells, enabling them to produce specific proteins that trigger an immune response. We wanted to investigate how this platform could be adapted for other infectious diseases and even non-infectious conditions like cancer.
Interesting. Could you explain how your research expanded on the existing knowledge about mRNA vaccines?
Of course. While the COVID-19 vaccines demonstrated the effectiveness of mRNA technology, there were concerns about stability, delivery methods, and durability of the immune response. Our study focused on optimizing lipid nanoparticles, which are crucial for delivering mRNA to cells. We also examined the potential of combining mRNA technology with adjuvants to enhance immune responses. Finally, we investigated its efficacy in preventing infections like malaria and respiratory syncytial virus (RSV).
You mentioned lipid nanoparticles. What makes them so essential in this process?
Lipid nanoparticles act as protective carriers, shielding the fragile mRNA molecules and ensuring their safe delivery into human cells. Without this delivery system, the mRNA would degrade rapidly and lose its functionality. Our research identified specific modifications to these nanoparticles that improved their stability and targeted delivery to immune cells. This advancement could pave the way for next-generation vaccines.
Did your study involve clinical trials? If so, how extensive were they?
Yes, our study included both preclinical and clinical phases. In total, 700 participants across 10 global sites took part in the trials. We tested the vaccines on individuals at high risk for malaria and RSV, ensuring a diverse representation of demographics and geographies. Additionally, a control group received placebo injections to evaluate the true efficacy of the mRNA vaccines.
And what were the key findings of your research?
The results were very encouraging. The mRNA vaccines showed high efficacy against both malaria and RSV, with immune responses lasting up to 2 years in most participants. We also observed a significant reduction in severe cases of these diseases among the vaccinated group compared to the placebo group. Moreover, the modifications to the lipid nanoparticles reduced side effects, making the vaccines more tolerable.
That's incredible progress. What are the next steps for your team?
Our immediate focus is to address scalability and cost-effectiveness. While mRNA vaccines have revolutionized vaccine development, their production remains expensive and resource-intensive. We're exploring partnerships with manufacturers to streamline production processes. Additionally, we're investigating how this technology can be applied to other diseases, such as tuberculosis and HIV, and even conditions like cancer.
It sounds like mRNA technology has enormous potential. Do you foresee it becoming the standard for vaccines?
Potentially, yes. While mRNA technology won't replace all existing vaccines, it offers unparalleled speed and adaptability, especially for emerging diseases. However, further research is needed to refine the platform and address challenges like storage requirements and equitable distribution.
Thank you, Dr. Collins, for shedding light on this transformative technology. We look forward to seeing how your work evolves.
Thank you for having me. It's been a pleasure to discuss these exciting developments with you all.
That is the end of Part C. You now have 2 minutes to check your answers.